Critical Thinking and Coding Tips for Chapter 22. Okay, our first critical thinking questions for this chapter. What are the coding differences between acquired and congenital hydrocephalus? Our answer, hydrocephalus is an excessive accumulation of cerebrospinal fluid within the ventricles of the brain. Acquired hydrocephalus is usually from a previous inflammation of the brain and is coded 331.3 through 331.4. Congenital hydrocephalus is a common cause of abnormally large heads in neonates. Hydrocephalus of a newborn is usually associated with other conditions such as spina bifida and should be coded as 741.0. If no reason is given, use the code 742.3. And our next question, what is the difference between an anomaly versus a deformity, as classified in ICD-9-CM? Our answer, for ICD-9-CM classification, an anomaly is a malformation caused by abnormal fetal development, therefore rendering an anomaly as congenital. A deformity is an alteration or distortion in a structure, which can be congenital or acquired. Now, documentation in the medical record may use these terms interchangeably and in fact use terms such as congenital deformity or congenital anomaly. If there is any confusion as to whether a condition is congenital, therefore potentially changing the code, query the physician for clarification. And our last question, can you code a newborn from the mother's medical records? Our answer, newborns will always have medical records separate from the medical records of the mother. Do not assign pregnancy codes to a newborn or vice versa. Most records of newborns will include copies of the delivery record of the mother in order to determine what happened during the delivery that may warrant coding on the newborn's record. Statistics such as weight and weeks of gestation may be recorded only in the mother's delivery record before the baby is transferred to the nursery. When determining certain codes, the weight and weeks must be known. For instance, if a baby is premature, it's necessary to know the weeks of gestation, as well as the weight to assign the correct code. The mother's record and the newborn's record should be consistent in their documentation. Okay, here we go with coding tips for Chapter 22. Put aside what you learned in Chapter 21 as you study and work through Chapter 22. In Chapter 22, it introduces you to coding the birth of newborns and infant conditions, which are totally different from Chapter 21, as you will learn in Chapter 22. For every workbook exercise in Chapter 22, you will be coding the services provided to the newborn or infant, and will use only codes from the ranges of 740 through 759 and 760 through 779. These codes will never be used on the mother's chart. They are specific to the newborn only. Now, just as you will never use codes from the range of 630 through 677 on the newborn's chart, because they are specific to the mother only. Also, the outcome of delivery, which is V27.X codes, will never be used on the newborn's charts. They are used on the mother's chart only. The live-born type of birth codes, V30.0X, are only used on the live-born newborn's chart and are never used on the mother's chart. There is nowhere in Chapter 21 that it instructs you to use the V30.0X range of codes for the mother. When a newborn is delivered during the encounter, the principal diagnosis will always be a code from the category of V30.0X, and this code will be used for this encounter only. It will never be used again on any encounter for this newborn. Then add any other codes from the ranges of 740 through 759 and 760 through 779 that apply. Now, do not use V39 in this class as a default code for a newborn. You should consider any newborn as a single live-born if not stated otherwise in the coding statements or case scenarios. To locate the type of birth code, begin your search in the index to diseases under newborn. Continuing on with the coding tips, the importance of reading all of the excludes notes as it relates to coding congenital condition, because many conditions can be either congenital or acquired. Often a diagnosis will have an excludes note if a condition can be congenital and will refer you to that congenital code. Now, every time you assign a code from categories 740 through 759, be certain that this condition is truly congenital on the basis of the documentation. And examples, diverticulosis of esophagus, congenital is coded to 754.0. However, diverticulosis of the esophagus acquired is coded to 530.6, and you will see the exclude notes that it excludes congenital diverticulum of the esophagus. Now, how cardiac outflow tract obstruction is coded. This is a congenital defect of the pulmonary artery. It includes atresia, agenesis, stenosis, and hypoplasia of the pulmonary artery. It's coded as 747.3, which is a congenital anomaly of pulmonary artery. Continuing on, meconium and conditions related to it. Now, meconium is the baby's first fecal material. Meconium aspiration syndrome is a condition in which the newborn aspirates or inhales meconium-stained amniotic fluid and has difficulty breathing. It must be documented by the physician in order to assign the code 770.1X. The terminology meconium in liquor and/or meconium staining should not be coded as true meconium aspiration syndrome. The code for meconium staining is 779.84. Meconium might be present in the amniotic fluid, but the newborn has not had any problems relating to the fluid. Now, aspiration syndrome is a serious condition and generally could affect the care given to the newborn. Once again, any of these diagnoses must be clearly documented by the physician in order for these codes to be assigned. And finally, the use of V20.2, which this code is used for well baby visits or follow-up visits. It's usually assigned for outpatient and or pediatrician visits. If there is any complication, sign, or symptom, that is the reason for the patient's visit. A complication sign and or symptom code should be used instead of the V code. Now, common procedures that might be performed on a newborn are phototherapy, which is exposure to sunlight and or UV artificial blue light for therapeutic purposes. It's used to treat jaundice. A circumcision, which is the surgical removal of the end of the prepuce of the penis. Elective surgery is done at the request of the parents of the newborn. IV antibiotics, or intravenous antibiotics given to a newborn for a confirmed or suspected infectious process such as sepsis. An intubation, which is insertion of a tube into the larynx or trachea for entrance of air, typically performed if the newborn is having respiratory distress or difficulty.